Okay, imagine this. You wake up one morning and your eyes just feel like sandpaper.
Ah.
Yeah, it's like someone sprinkled sand in them and they're glued shut.
Mm.
And then you finally manage to pry them open and they're bloodshot and itchy and, oh yeah, there's that goo.
Yeah.
So what is going on here?
Well, that sounds like the classic conjunctivitis experience.
Ah, conjunctivitis, better known as pink eye.
Right.
It's something that we kind of joke about, but it can be surprisingly complex. And we are going to dive deep into this common ailment today. We're going to explore its causes, symptoms, and treatments.
It's really amazing how something so tiny like the conjunctiva can cause such a big disruption to our lives.
Yeah, the conjunctiva, that thin, transparent membrane that lines our eyelids and covers the whites of our eyes. It's practically invisible, but when it's inflamed, you definitely know it's there.
Exactly. It really makes you realize how much we take our eyes for granted until something like this happens.
So tell me, what is actually going on when someone has conjunctivitis? What's happening in the eye?
Well, conjunctivitis is basically the inflammation or swelling of that conjunctiva we were talking about. It's a very common condition and can be caused by a number of things.
Okay, so like what? What are some of the culprits behind those sticky red eyes?
Well, there are three main types: infectious, allergic, and irritant. The infectious kind is caused by bacteria or viruses.
So it's contagious.
It can be, yes. Infectious conjunctivitis spreads easily through direct or indirect contact. So let's say you shake hands with someone who has it and then you touch your eye, you could get it too. That's why good hygiene is really important.
Makes sense. So if it's caused by bacteria or viruses, it's contagious. What about allergic conjunctivitis? Could you catch that from someone?
No, allergic conjunctivitis is not contagious. It's triggered by an allergen, something that your body identifies as a threat.
Even if it's harmless.
Even if it's harmless, right, like pollen or pet dander, your body overreacts, releasing histamines and other chemicals that cause the conjunctiva to become inflamed.
And irritant conjunctivitis. Is that like when you get shampoo in your eye?
Exactly. Anything that irritates the eye can trigger conjunctivitis. Smoke, fumes, chlorine in a swimming pool.
So as we've got these three main categories. Regardless of the type, what are some of the telltale signs that you might have conjunctivitis?
Well, redness is usually the most obvious symptom, hence the name pink eye. But you might also experience a gritty sensation, like there's sand in your eye.
And that sticky or watery discharge that we were talking about earlier.
Yeah, you might also have itching, blurred vision, and even your eyelids sticking together, especially in the morning.
Oh, that's lovely.
Okay.
Okay, so let's say I wake up with itchy, red, goopy eyes. How do I know what kind of conjunctivitis I have?
Well, that's where a trip to the eye doctor comes in. It's important to get a proper diagnosis because the treatment really depends on the underlying cause.
Okay, that makes sense. So let's start with bacterial conjunctivitis, since it's the contagious one. What causes that?
Usually bacteria like Staphylococcus aureus, Streptococcus pneumonia, and Haemophilus influenza, not the usual suspects. They cause that thick pus-like discharge that can be yellow or white or even green.
I actually remember when my niece was little, she had it. And it started in one eye and then it spread to the other. How is bacterial conjunctivitis treated?
Well, the good news is it usually responds very well to antibiotic eye drops or ointments.
So a quick trip to the doctor, a prescription, and I'm back to normal.
More or less, yes. But there's a note about azithromycin eye drops.
Oh, okay. What's the deal with azithromycin?
While it is an option, it can be more expensive, and more importantly, it contributes to the growing problem of antibiotic resistance.
So it's not always the first choice. Good to know. What if you wear contacts and you suspect you have bacterial conjunctivitis?
That's a good question. If you wear contact lenses and develop bacterial conjunctivitis, it's crucial to stop wearing them immediately and see an eye doctor. Contact lens wearers have a higher risk of complications from bacterial conjunctivitis.
Okay, speaking of complications, can bacterial conjunctivitis cause any long-term problems if it's left untreated?
In some cases, yes. If it's not treated promptly, the infection can spread to the cornea, the clear front part of your eye, and cause something called keratitis.
Keratitis, that sounds serious.
It is. It's an inflammation of the cornea, and it can be very painful. In severe cases, it can even lead to vision loss.
Okay, that's definitely a good reason to see a doctor right away. Let's move on to viral conjunctivitis. Is that as common as the bacterial kind?
It's actually more prevalent in adults. The most common culprits are adenoviruses, but many other viruses can cause it as well.
And what are the symptoms like? Are they different from bacterial conjunctivitis?
The discharge is usually watery rather than thick and pus-like, and it often affects both eyes from the start. It can also be accompanied by other cold-like symptoms like a runny nose, sore throat, cough, and you might notice swollen lymph nodes in front of your ears.
So it's like a cold that affects the eyes.
Exactly. And unfortunately, there's no cure.
Wait, so if I get viral conjunctivitis, I just have to suffer through it?
Pretty much, yes. It usually clears up on its own within a week or two. The virus just has to run its course.
Well, that's reassuring at least. But what about those really severe cases we hear about? Can viral conjunctivitis cause any lasting damage?
There is a particularly severe form called epidemic keratoconjunctivitis, which can cause inflammation of the cornea and in some cases even lead to scarring. That definitely requires an eye doctor's attention. But for most cases, supportive care like cold compresses and artificial tears can help ease the symptoms while you wait for it to clear up.
So cold compresses, artificial tears, just kind of wait it out. Now let's talk about allergic conjunctivitis. What triggers this type?
Well, as we mentioned earlier, it's triggered by allergens like pollen, dust mites, pet dander, mold. The telltale sign is intense itching, often accompanied by other allergy symptoms.
So it's like your eyes are saying, hey, I'm allergic to this too. What's the best way to manage allergic conjunctivitis?
Well, avoiding those allergens is key, of course, but there are also some very effective medications that can help.
Okay, what kind of medications are we talking about?
Well, antihistamine eye drops are commonly used, as well as mast cell stabilizer eye drops. And there are even combination drops that contain both.
And in really severe cases?
In severe or persistent cases, your eye doctor might prescribe a short course of topical corticosteroids. But remember, those are serious medications with potential side effects, so they should only be used under a doctor's supervision.
Good to know. And here's an interesting fact I came across in my research. Research suggests that drug-eluting contact lenses that release ketotifen, a mast cell stabilizer, could be a game changer for allergic conjunctivitis.
That is really interesting and exciting. It just shows how innovative treatments are constantly being developed. Now let's shift gears and talk about some less common but potentially more serious types of conjunctivitis.
Okay, so this is where things get really interesting. We've covered the more common types of conjunctivitis, but let's dive into some of the rarer forms that can be even more serious. Let's start with vernal keratoconjunctivitis, VKC for short. What is that, and how is it different from those other types of conjunctivitis that we've already talked about?
Yeah, VKC is a little bit of a mystery. It's a chronic form of allergic conjunctivitis, but it's way more severe, and it really tends to target young boys living in warmer climates.
So it's not your average pink eye.
Not at all. It can be pretty intense. Think severe itching, thick mucus discharge, and then these large bumps called papillae that form on the inner lining of the upper eyelid.
Oh, that sounds awful. How is VKC treated?
Well, because it is so severe and persistent, VKC often requires a really long-term approach to manage it. And that usually involves a bunch of different medications, including topical corticosteroids, mast cell stabilizers, sometimes even immunosuppressants might be necessary.
Wow, that sounds intense. And speaking of intense, what about atopic keratoconjunctivitis, or AKC? What makes that one so concerning?
AKC is another chronic form of allergic conjunctivitis, but this one is often seen in people who have atopic dermatitis, which is eczema. And this one's not just about discomfort. This can actually threaten your vision. If it's not treated aggressively, it can lead to corneal scarring and even vision loss.
Okay, that is really scary. What does treatment look like for AKC?
It's similar to VKC, involving kind of a multi-pronged approach with medications like topical corticosteroids, mast cell stabilizers, and then again, in more severe cases, those systemic immunosuppressive medications might be needed to really get that inflammation under control.
Okay, so the takeaway here is if you suspect you or your child might have VKC or AKC, see an eye doctor right away.
Absolutely. Don't wait for things to get worse because early intervention is key here for preventing any long-term damage and preserving vision.
Couldn't agree more. This brings us to another really important point. No matter what type of conjunctivitis you think you might have, if it's not improving with just basic home care or over-the-counter treatments within a few days, or if your vision is affected at all, it's time to see an eye doctor.
Yeah, exactly. Better safe than sorry, especially when it comes to your eyes.
Absolutely. Okay, so let's say you do head to that eye doctor with a suspected case of pink eye. How are they going to actually figure out what's causing it? What tools and techniques are used to diagnose the different types of conjunctivitis?
Well, it often starts with a good old-fashioned physical exam where the doctor will take a look at your eyes. They'll ask you about your symptoms, check for things like redness, discharge, swelling. They'll also pay close attention to your cornea, looking for any signs of damage or infection.
Makes sense. But I'm guessing they also have some pretty high-tech tools at their disposal, too.
Oh, absolutely. One of the most important tools is the slit lamp.
Okay, for those of us who haven't spent much time in an ophthalmologist's chair,
Yeah.
can you explain what a slit lamp is and what it does?
Sure. Think of it as like a microscope for your eyes. It's a specialized instrument that lets the doctor see your eyes in really incredible detail. They can see the different layers of the eye, identify any abnormalities, even get a closer look at the tiny blood vessels in the conjunctiva.
Wow, that is pretty impressive. I remember when I was a kid going to the eye doctor and they put this orange dye in my eye and then everything was glowing under this blue light. What was that all about?
Ah, yes. That orange dye is called fluorescein, and it's a really cool tool for detecting any damage to the cornea. So if you have a corneal abrasion, for example, the fluorescein will actually stick to it and light up under that blue light. So it's a really effective way to visualize any problems with the surface of the eye.
So like a highlighter for eye injuries.
Exactly. But as amazing as the slit lamp is, it does have some limitations. For example, it can't accurately measure the depth of corneal ulcers, which is really crucial information when you're trying to determine how severe an infection is and what the outcome might be.
Oh, wow. So what do they do in those cases? Are there other imaging techniques that can provide that information?
There are. One of the newer technologies that's being used is called anterior segment optical coherence tomography, or ASOCT for short.
Try saying that 3 times fast.
I know, right? It's a mouthful, but it's a really incredible technology. Think of it as an ultrasound for your eyes. It uses light waves to create these incredibly detailed images of the eye's structures, including the cornea.
That's amazing. So with the slit lamp and the ASOCT, eye doctors can really get a comprehensive look at what's going on inside the eye.
They really can. It's like having a window into the eye, allowing them to see things that you just couldn't see with the naked eye.
So now that we've talked about diagnosis, let's move on to the most important part, treatment. We know that there are a lot of different treatment options available depending on the type of conjunctivitis. Can you just give us a quick overview of the main treatment approaches?
Sure. For bacterial conjunctivitis, as we mentioned earlier, the mainstay of treatment is antibiotics, usually given as eye drops or ointments.
And it's really important to complete the full course of antibiotics as prescribed, even if your symptoms start to improve before you've finished all the medication.
Yeah. Absolutely. Stopping those antibiotics early could allow those bacteria to make a comeback and make the infection even harder to treat.
Right, okay. And what about viral conjunctivitis? I know there's no cure, but what can be done to help ease the discomfort?
Well, with viral conjunctivitis, it's really all about supportive care, which can include things like cold compresses to help reduce inflammation and soothe the eyes, artificial tears to help lubricate the eyes and flush out any irritants, and over-the-counter antihistamine eye drops can help to relieve that itching.
That makes sense. And of course, good hygiene is crucial because viral conjunctivitis is highly contagious.
Absolutely. Frequent hand washing, avoiding touching your eyes, and not sharing personal items like towels or makeup. Those are all really important steps to help prevent spreading that infection to others.
Yeah, good hygiene is always important, but especially when you're dealing with something contagious. Now, allergic conjunctivitis, what are some of the go-to treatments for that?
Allergic conjunctivitis is often managed with a combination of allergen avoidance and medications.
So things like antihistamine eye drops, mast cell stabilizer eye drops, and then those more severe cases, corticosteroids.
That's right. Identifying and avoiding those triggers is key. If you know you're allergic to pollen, for example, try to stay indoors on days when the pollen count is high.
Makes sense. Now, for those less common but more severe types of conjunctivitis that we talked about earlier, like VKC and AKC, what kind of treatment approaches are typically used?
Those conditions often require a more aggressive approach. We're often talking about a combination of different medications, including topical corticosteroids, mast cell stabilizers, and even in some cases, immunosuppressants.
Sounds like there's a whole arsenal of treatment options available.
There is. And that's exactly why it's so crucial to see an eye doctor if you have any concerns about conjunctivitis, because they can really help you figure out what's causing your symptoms. They can assess the severity of your condition and then recommend the best course of treatment for your particular situation.
Now, speaking of concerns, we've touched on some of the potential complications of conjunctivitis, but can you delve a little deeper into the long-term risks? What should people really be aware of?
Yeah, it is important to remember that most cases of conjunctivitis are relatively harmless. They resolve without any lasting effects. But as we've been talking about, some types, especially if they're not treated, can lead to more serious problems down the road.
Like those corneal ulcers and scarring we talked about earlier.
Exactly. And even though allergic conjunctivitis is often thought of as a fairly minor ailment, chronic rubbing, irritation can sometimes lead to damage to the cornea over time. So it's important to manage those symptoms effectively and avoid rubbing your eyes as much as possible.
So even though most cases are mild, it's still important to be aware of the potential for complications.
Absolutely. Early detection and treatment are key to preventing any long-term damage.
We've talked a lot about the different types of conjunctivitis, how they're diagnosed and all the treatment options out there. But let's take a step back for a minute and focus on the conjunctiva itself. It's such a thin, delicate membrane, and it's constantly exposed to the elements. So how does it handle all that wear and tear? The scratches, the scrapes, just the daily grind. How does it heal?
Well, the conjunctiva is actually a pretty remarkable healer. It's constantly repairing and rebuilding itself. It's like a master craftsman.
Okay, so walk me through this process.
Yeah.
What actually happens when this very delicate membrane gets injured?
So imagine you've got this tiny little scratch on the surface of your conjunctiva. Okay, the body immediately springs into action. It launches this incredibly well-coordinated and carefully orchestrated sequence of events to repair that damage and get its function back as quickly as possible. And the first stage of this process is called the inflammatory phase. And this is basically the body's natural alarm system. It's the signal that, hey, something needs attention here.
So the body's sending out an SOS.
Exactly, exactly. So these chemical messengers are released and they call in the first responders, which in this case are the immune cells. The neutrophils, the macrophages, they rush to the scene, they clear away debris, they fight off any potential infection that might be trying to take hold, and they basically set the stage for the healing process.
It sounds like a well-coordinated rescue mission.
It really is. And once that initial cleanup is complete and that inflammation starts to subside, the healing process then moves on to the next phase, which is called proliferation. And this is where the real rebuilding begins. So new cells are generated. They form this fresh layer of tissue to replace the damaged area. New blood vessels sprout, like tiny little pipelines. They're delivering vital nutrients and oxygen to the healing site.
So it's like constructing a whole brand new section of the conjunctiva.
Exactly. And to make sure that this new structure is strong and resilient, these specialized cells, called fibroblasts, get to work, and they weave together these strands of collagen.
Ah, collagen. That's the protein that gives our skin its elasticity, right?
That's right. And it plays a really important role in wound healing throughout the body. It gives that structural support and strength to damaged tissues. So as the healing progresses, this new tissue matures and remodels. It's fine-tuning the repair, smoothing out any rough edges. And this final stage is called the remodeling phase. And the goal here is to get that conjunctiva back to its original glory, both structurally and functionally.
It's incredible how the body knows exactly what to do to heal itself. But what happens if things don't go according to plan? Are there any potential complications that can arise during this healing process?
Yeah, just like with any healing process, there's always a chance that things won't go perfectly. And sometimes the conjunctiva can actually overheal, and that can lead to the formation of scar tissue.
Scar tissue isn't good, right?
It depends on where it forms. So in most cases, a little bit of scar tissue on the conjunctiva itself, it's not a big deal. But if it forms on the cornea, which is that clear dome-shaped front part of the eye, that's when it can start to interfere with your vision.
Oh, so it's kind of like having a permanent blemish on the eye's lens.
You could think of it that way. Scar tissue on the cornea, it can scatter the light as it enters the eye, and that can lead to blurry or distorted vision.
So it sounds like preventing scarring is really important.
Absolutely, and that's why it's so important to treat any underlying condition that might be causing the conjunctivitis. And it also highlights the importance of proper wound care. So if you have an eye injury, it's essential to follow your eye doctor's instructions very carefully to help minimize that risk of scarring.
Okay, so we've talked about the conjunctiva's remarkable ability to heal itself. But it also plays another really important role, right? It's a key player in the eye's immune system.
Absolutely. The conjunctiva is like this vigilant guardian. It's constantly standing watch over the eye. It's on alert for anything that might try to invade. It's really the eye's first line of defense against pathogens and other foreign substances that could cause harm.
So it's like a protective shield guarding the eye from the outside world.
Exactly. And it's teeming with these immune cells that are ready to spring into action at a moment's notice. It also produces antibodies, which are those targeted proteins that can neutralize specific threats.
It sounds like a really formidable defense system.
It is, but sometimes, and as we've seen with allergic conjunctivitis, the immune system can overreact. It can mistake harmless substances for dangerous foes.
Those poor pollen grains.
Yeah, it's almost like it's a little overeager to protect the eye, and it launches an attack even when there's no real threat present.
And that overzealous response is what leads to all those familiar symptoms of allergic conjunctivitis.
Mm,
The itching, the redness, the swelling, the watery eyes.
exactly.
Well, we've covered a lot of ground today exploring this fascinating and sometimes frustrating world of conjunctivitis. We've gone from the common culprits behind pink eye to the conjunctiva's incredible ability to heal and defend itself. It's really clear that there's a lot more to this seemingly simple condition than meets the eye. So as we wrap up today, what are some of the key takeaways that you would like our listeners to remember?
Well, I think it's important to remember that conjunctivitis is a common eye condition, and it can have a variety of different causes. Infections, allergies, irritants, and while most cases are mild and resolve on their own with proper care, some types, as we've discussed, especially if they're not treated, can lead to much more serious problems, including vision loss.
So it's important to take eye health seriously.
Absolutely. If you have any concerns about your eyes, if you're experiencing any kind of unusual or persistent symptoms, it's really important to see an eye doctor. Early detection and prompt treatment are absolutely key to protecting your vision.
That is excellent advice. Well, that concludes our deep dive into the world of conjunctivitis. We hope you found it informative and helpful. Remember, your vision is a precious gift, so don't take it for granted. And if you have any concerns at all, don't hesitate to reach out to your eye doctor. Until next time, stay curious and keep those eyes healthy.